Hello, the second video that you're watching is a self-critique of my video conducting Christian Integrated Prolonged Exposure Therapy with my client, Ms. Penny Latham. As I provide a self-critique, I will refer to positive aspects as pros and negative aspects or areas for improvement as cons. I will start with the pros first. The first pro is that I addressed sensory, cognitive, and emotional experiences during the imaginal exposure. Secondly, I feel that I demonstrated good rapport with the client. This is evidenced by making appropriate eye contact, exhibiting open body language, such as occasionally nodding and smiling. A third pro is that I praised Penny throughout her imaginal work. I made statements such as good job, you're doing well, you're doing excellent, and continue. As a counselor, I also consistently asked Penny about her SUDS level in order to provide continued assessment during the course of the imaginal exposure narrative. Also, I think I did a good job presenting Penny's case relative to her biopsychosocial development and medical histories. The information that was presented was very rich and full of details. Moreover, I provided a detailed overview of the index trauma. The amount of time that was invested in the case presentation was important because I felt that this would give the audience a clear understanding of Penny and her life and how said aspects connect to the meaning she assigns to the index trauma, her view of herself, others, and the world around her. Another reason for the level of detail offered in the initial portion of the video was to communicate to the audience that Penny is indeed an appropriate client for PE, especially given that PE is counterindicated for specific populations. A sixth pro was that I provided a detailed overview of the previous sessions and topics. Furthermore, within the PowerPoint slide, I included homework that was completed in and after those prior sessions in order to provide points of reference for the viewers. These points of reference hopefully augmented the viewer's understanding of where Penny and I were in the third session. The last pro was that as a clinician, I think that I did a fairly good job of incorporating Penny's Christian faith into the session. This was evidenced by asking her if she felt comfortable with prayer to initiate the session, as well as honing in on cognitive distortions at the end, as related to her thoughts about God punishing her through trauma and its associated guilt and shame. One of the cons was experiencing trouble with my computer and the recording features. I had quite a bit of difficulty getting Penny and myself into the camera's frame. This made it very difficult to fully face her as I typically do with my clients. One of the contributing factors was that I wanted to have just one video recording which connected both the case presentation and the session. The transition between those two pieces proved to be rather difficult. There was too much time investment to redo these. Another con was there were a few times when I didn't speak as clearly and as articulately as I would have liked. I acknowledge that this can create confusion with the client as well as with the viewers. Another con was having Penny focus on just one item on her in vivo hierarchy. In this session, we reviewed her homework in which she shared about her experience with the one in vivo item. However, I should have assigned 2 items for focus, as that's typical in PE therapy. I didn't catch this until afterwards. The final con was the excessive lighting in the physical environment. The blinds in my windows should have been drawn closed to reduce glare on the recording screen. This would have improved the quality of the image and the pixelation. Additionally, the lamp that I had turned on was rather bright and was somewhat distracting to the client. Regardless of whether or not this was a mock session or a real session, the physical environment needs to be taken into consideration because it can distract the client from the work at hand. This is applicable also to clients who are receiving services via telehealth. Thank you.